Did you know that simple mistakes in your advanced directives could make it useless, especially when you need it the most? You want your advanced directives to be bulletproof. Today, we are covering most common mistakes people do in making and filling advanced directive forms. We have divided this video in common errors and issues which we see. Healthcare agent issues. If you do not name your healthcare proxy or agent, legal algorithm will take care of you. That will be your spouse, your children, your family members, friends. Then it keeps on going till it reaches state pointed somebody who even doesn't know you exist in this world. So you make sure that you fill in the form for healthcare proxy. It goes with the different names, durable power of attorney, healthcare surrogate form, but they all mean the same. Make sure you point somebody who is trustworthy, whom you know, you have deep discussions with them regarding your wishes and what are the things you do not want. And above all, they must be above the age of 18 and they must be willing to act on your behalf. We have seen that when we fill in the form, that you put it in that form two names rather than one now form. Legally, as you know, advanced directive is a legal document. When you put two names in that form who should be your healthcare surrogate, then you are giving equal authority or 50-50% authority to make a decision on your behalf. The way in my research I found it out, the law treats that for any decision which you need to make, they both have to make a joint decision. In my discussion with my patients, the intent was one of them, whosoever is available, to make a decision. If you want to list them on separate 1 and 2 and state any of them can make, so that there is no issue regarding legally for your healthcare team to understand and interpret it properly. Next mistake which we see is not updating your advanced directives. Your circumstances have changed. People who are willing to act on your healthcare surrogate have moved on or they have died in many cases, which we found, and they simply do not want to be burdened with that responsibility. Whenever there is a major change with you or your healthcare surrogate, update them. It is a simple process. You fill in the new forms, get them signed, notarized, whatever needs to be done depending on your state, and distribute to your healthcare team. We have seen in our experience the situation which are very common is a divorce. Once you get divorced, your divorcee does not want to act as your healthcare surrogate. Update them as many times you need to. Next pitfall or mistake we do is vague instructions. Yes, healthcare advanced directives are a document which is legal and it's for future. You still want to provide clear instructions. When you provide vague instructions, if happen this, it is not clear. You must go through the journey of imagining yourself, overseeing yourself in that circumstances, that how you want your end of life to be understood and taken care, your palliative or comfort care, what kind of treatment, medical, surgical, or experimental you will accept, under what circumstances you will accept organ donation or you will not be an organ donor, whom you want to be informed, how you want your body to be disposed, what you want your healthcare providers be dressing you as, and how you want your family to be involved, and what are the messages you want to give them at time of your death. Make sure you clarify all and Be as specific you can. Yes, life is very uncertain, unpredictable. We cannot imagine all the scenarios and we cannot cover, but it should cover the decisions which are important to you and make sure those are written there. Next common mistake we see is omitting personal values. People are very good making medical decisions, but people do not think through what matters to them the most. Make sure you put what matters to you the most on paper so that we follow and your healthcare team goes through that part. Lack of communication, very common. If you have made advanced directives and nobody knows and your healthcare team is not aware, they are totally useless. Nobody will be able to locate them at the time of crisis. Make sure you properly distribute to your healthcare team. Improper signing. If you meet all the legal requirements, then only it's a legal document. We see most common errors in witnessing it and getting it notarized if your state requires. Witness cannot be your healthcare proxy, and your healthcare team cannot be your witness. Make sure you follow those simple rules and you have everything T's crossed. Ignoring state laws. Most of the time, general principles hold good in every state, but each state, and you must familiarize where you live, what are the legal requirements by your state. Next is very commonly we see is confusion with other documents. These documents are only about your healthcare wishes, demands, and needs. That has nothing to do with any other aspect about your life. It does not handle your property, it doesn't handle anything. It is only about you and only healthcare. And not sharing your information with others, I think, is a cardinal sin if you have advanced directives. I hope you understand the pitfalls and you avoid them so that at the time of crisis, when the unexpected is happening or happen, nobody is scrambling. You could look at yourself from above and be certain all your wishes are followed. Thank you very much. I have linked another video in the cards